One of the things I learned from my autism kids is that healing happens in two different ways. And if I can understand which way the person needs, it'll go smoother. So there are people that need to heal from the inside out. There are people that need to heal from the outside in. Like if the person has eczema, but I can see that they've got deeper disorders inside, I'm going to work from the inside out. If the eczema is a result of something internal, I'm more likely to work from the inside out. But if it's just an external thing, I might work from the outside in. I also look at the things like, I always ask my patients, what do you find is most healing for you? What makes you feel best? If people say to me things like...
Today's guest is Kim Kalina. Now, this is a woman who I've heard so many homeopaths speak of with the deepest reverence, especially around the important work she has done around triturations, inspiring homeopathy, and cease therapy. So to actually have a moment to sit down with her and pick her brain was definitely a highlight for me. Kim was so generous with sharing her wisdom that we were able to split this up into 2 separate episodes, so do check back in tomorrow for a bonus episode. So a bit about Kim. She is a highly respected, certified homeopath and teacher. She trained directly with Tinus Smits in 2005 and worked closely with him in developing and teaching cease therapy and inspiring homeopathy until his death in April 2010. At this time, she agreed to continue spreading his important work around the world for him. She does speak a bit more about this in the episode today. Kim is also a former musician and initially trained in social work, psychotherapy, and sound healing before finding homeopathy. And she has taught at schools, conferences, and seminars worldwide for more than 25 years. She has committed her professional life to supporting homeopathic students and colleagues as we learn and grow, deepening our relationship to and with healing. You can find out more about Kim through the Irish School of Homeopathy's website, which is ish.ie. Thanks so much for listening.
Welcome to the Homeopathy Hangout podcast, where we discuss all things homeopathy from around the world. And now our mum and your host, Eugenie Kruger.
Hello, homies, and welcome back to Homeopathy Hangout, where today I have the immense pleasure of introducing you to the one and only Kim Kalina. Welcome to the show, Kim.
Thank you, Eugenie. It's an absolute pleasure to finally, you and I, be able to chat in person. So I'm really grateful.
Your name has been mentioned by so many homeopaths on this podcast. It's so many people talk to Kim Kalina. And people are, have you talked to Kim Kalina?
No.
Yes, I've been trying to get her on. Have you been? So your name has been thrown around so many times on this podcast. So to actually talk to the legend herself is quite remarkable.
I hope I can live up to that. I'm not sure of that. Okay.
I tell you what, though, we have one thing on the podcast that I ask all my guests, no matter how famous you are, and that is, how were you first introduced to homeopathy?
That's an interesting one. So I came to homeopathy, so many other people, through my son, who's now in his 30s. But when I was quite ill during my pregnancy with him, I had hyperemesis gravidarum. So I couldn't eat for 7 months, and it was quite an interesting vomiting thing. And when Joey was born, he was one of the very first cohort of kids in the States. I lived in New Jersey at the time, that was given the Hep B vaccine 2 days after birth. My background, I was raised a Christian Scientist, so I actually was never vaccinated other than a tetanus shot I was given in my 20s. But at that point, I'd never been vaccinated. I wasn't going to vaccinate him. I didn't see a need to. I'd been raised around non-vaccinated people. I didn't have any fear around getting sick. I knew I could be well and he'd be fine. And he immediately went into a colicky sort of state. He was screaming all the time, lots of issues. But my background was in social work, so because I'd been raised a Christian Scientist, I'd actually never seen doctors until I got pregnant. So I didn't have really any knowledge of the medical world at all. Didn't really think too much about it, especially since I've been sick for so long. And I just breastfed and did all the things I could think of to do. And he eventually started to come out of it. When he was about 11 months old, my mother-in-law begged me to get him his next round of vaccines. And I was like, he doesn't need them. We haven't done them. He's doing fine. He's finally well. And she was like, please, I'm worried he's going to die. I lived through polio. And she'd seen kids die of polio and she was terrified. So I was like, look, fine. I wasn't worried. I thought, fine, I'll take him. I took him. And he was given another round of Hep B, but also with the DTAP. And within hours had vomiting and diarrhea coming out of both ends, like pouring out, collapsed. We had to rush him to hospital, and basically they gave him a 50% chance of living. So I did the classic mom thing of I was sat in the pediatric ward with this limp baby on my chest and doing a deal with God that if you let this child live, I will do whatever it is you ask of me. God, I had no idea what that was going to be. But he pulled through. He managed to pull through. And from that moment forward, he was constantly sick. Ear infections, throat infections, just constantly unwell, stomach bugs. And a neighbor of ours, very luckily, had a very disabled child and said, you know what you need? You should go see this homeopath I know. And that was the same day that I'd been to see my pediatrician, who himself had a Down syndrome child and had said to me, look, Kim, I can keep giving you antibiotics, but he said, it's not going to fix things. He said, what you need is somebody to strengthen his immune system. We take my son to a naturopath in the city, but you just want some sort of natural healing technique because medicine doesn't do that, right? That's what natural healing does. And then my neighbor said, oh, go see this homeopath, Jane Cicchetti, who lived less than a mile away from my house. So I took Jerry to Jane. Jane gave him Virachum album, and he stopped getting sick. And that was astonishing to me. And I was at the end of my social work training. I was just about to go into practice. I was already seeing patients. And I thought, this is so much more powerful than what I'm doing. I need to learn more. And she said, come to my acute class. So I did her intro acutes class, was astonished when I saw that there were things for emotional healing, and immediately signed up to the 3-year program. And the rest is history, really. But it just sucked me in, hook, line, and sinker. And I've used it ever since. It's been amazing. And I did cease work with my son. I did some of that. But the real healing for me was primarily from the homeopathy, the deeper classical remedies. I learned a lot through him. My husband at the time also had been depressed since he was 12 years old. He'd been on antidepressants for 30 years. So I then set about seeing if we could figure out how to get him off the drugs. And we eventually got him off all the medications and got him feeling well. And so it took me into a lifelong practice. And my specialty for many years was working with trauma and abuse. And that was my sort of love when I was going into therapy. It was like being able to be present for those people. And having homeopathy as a tool was amazing. Such
How
deep
lucky you
transformation.
found Jane. Just big ups to Jane. So she prescribed me a remedy a couple of years ago that was profound for me.
Yeah.
I've had her on the podcast a few times. We've got an episode coming out with her and Vit, because I said to Jane, can you, when you and Vit are talking to each other, can you just record it and just send it to me to share it with people? Just talk, like however you normally were talking. And she did, her and Vit did. So that episode will be out just a little bit. But
Jane's amazing. And I was very lucky because the school at the time was Jane taught half the classes and Joel Kreisberg, who was a chiropractor and homeopath in the city, taught half the classes. And Joel had a clinical program in the city. And I accelerated really quickly in the early years of the program because I already had patients as a therapist. So I was wanting to apply this more quickly. So he took me into the clinical program in year 2 and said, look, you just come into the city and do the clinical program. So I did a 2-year clinical program at the same time as I was doing a 3-year full-on homeopathic program. It was slightly full-on, but it's how I tend to do things. But getting those 2 different opinions, because Jane is very much that Jungian therapist. She's got that side. It's so strong. 5 elements was her center at the time. She had a lot of Chinese medicine theory. She had so much wisdom in that way. And then Joel was a real plant guy, like huge plant earth medicine knowledge. And because he was a chiropractor, he had the structural and anatomy, physiology, pathology. And in fact, he was the one that said to me, look, you've got no knowledge of Western medicine at all. Why don't you take some courses? You're going to need it for your CHC exam anyway. Take some courses and maybe sit in with some doctors. And he had suggested homeopathic physicians, but I thought, I just want to sit in with doctors. So I did this thing where I would do 6 months. I did part-time work in doctors' offices. So I did the GP, then I worked for a psychiatrist for 6 months. I worked for a radiologist for 6 months. I worked for an orthopedist for 6 months. So I went and just worked for different doctors so that I could understand that world from the inside because I had no understanding of it. And by the end of it, I was like, wow, this is amazing. Now I understand how to integrate these things. I understand the value of that, but also all the foibles of it, and did lots of pre-med courses. So I immersed myself in that world. But because I'd done homeopathy first, that was really beneficial because I could take in all the medical stuff from the perspective of homeopathy, which was incredibly useful. So yeah, I just go where I'm led. I've always done that. I assume I'm going to land at the right place at the right time.
Imagine if
So,
most people live their lives that way. How good would that be if we just kind of trusted in the universe and instead of fighting so much?
yeah.
You were also teaching pretty soon after you graduated, you were saying, hey? You've been teaching for a long time, and I know my friend Janie Lavelle said that you taught her, and she's like, I just remember Kim turning up and putting placenta in a sound bowl at our school, and it's just the amazing teachings that you did. So tell us a little bit about that side of things as well.
Yeah, like pretty, I got thrown into teaching. The person that most people that know me now are like, really, Kim? When I was in school, I was that person that was like, what do you mean I have to do a presentation in front of the class? No, I don't do that. I'm not doing that. I was never the person that wanted to be in front of the class. I never wanted to talk. Didn't want to do any of that. Joel and a friend of his, Tim Owens, ran Joel's school, Teleosis, in New York City. And that's where the clinical program was that I attended. And Tim kept winding me up saying, you're a natural teacher. You need to teach. You need to do this. And I was like, no, I'm not doing this. And then Joel's mother became ill and he was going to have to move to the West Coast to care for her. And he said, look, I really need more teachers. You're great as a supervisor with the students. I really want you to think about this. And I said, look, I'm willing to entertain it, but only if you and Tim teach me how to teach. Because at the time in homeopathy, and this is in the 90s, there were loads of teachers, and I'd been to loads of conferences and things, but they were really good at talking constantly, but they weren't really teachers. They weren't good at really conveying in a way that you could learn from. It was more like, wow, look at this amazing thing I've done. Look at these amazing cases I've got. But we would sit there going, how do I do that? I don't know how to plug those two things together, right? And it's really common in homeopathy. So I said, I'm not going to do this unless you teach me how to properly teach. I don't want to be one of those people that's just sharing a bunch of amazing cases and everybody's going, what do I do with that? So Tim said, I'll take you on. You sit in with me. And he said, you come to the next weekend. I'm going to be teaching lycopodium and I can't remember what else. And he said, you can sit and observe me teaching. And then at the breaks and at lunch, you can ask me any questions you have about the teaching and we'll just go from there. So I watched him teach in the morning. He taught some organon and a few things. Took a break. How's it going? I asked him some questions. He fed back to me. Went back to the class. Everybody sits down. And most of this class knew me because I'd recently graduated, right? So they were first years when I was graduating. And Tim says, now we're going to learn lycopodium and Kimmy's going to teach it to you. And I was like, what? No, Kimmy's not going to teach it to you. And he goes, want Kimmy to teach it to you, don't you? And they were all like, yeah, Kim, teach it to us. And I was like, oh my God. and he knew I wouldn't refuse to get up. He knew it would push me to do it. So I got up. I taught lycopodium off the top of my head, which was like, this is going to be crap. And they loved it. And they were like, this is amazing. We get it. And we went to lunch and I said to Tim, what the hell were you thinking? You could have told me. I could have prepared. And he said, yeah, but you wouldn't have done it. He said, you just did it. They understand lycopodium. I said, well, how do we know? And he said, look, I'm going to give them a little quiz in the afternoon and you can see. So he did. And they remembered everything I taught them. And I thought, okay, all right, I'm willing to entertain this then. And then from there, they just started teaching me really how to teach. And they would critique me. They would sit in the back of the room and say, next time do this like this, or think about this, or rearrange the room. Or there were lots of techniques around not just having everybody in rows staring at you, but try and arrange the room so people are looking at each other and learning from each other, not just you. And that felt more natural to me. It's like, I see my role as a teacher more as a guide than as some wise person imparting what I know. It's more, I'm trying to help guide you to find your own knowledge. And I'll give you bits of mine, but I want you to then pick up and find what yours is,
So I have a question. Do you teach people to do that? Because now, obviously, I have got this new school that I'm running in Australia, and I don't know how to teach. So luckily, most of the lectures come from the UK, so that's fine. Like the content from there, but I do a tutorial like every week or so, and I'm just like winging this, but the students seem to be enjoying it and learning, and they're excited. So I must be doing something right. But I would love to, because teaching really is an art.
Yeah.
My mother was a
That's what they
teacher for
taught me.
40 years, and she was the best.
Well, see, you know it then.
No,
Well, if
no,
you've
'cause
got
I
a mum
don't,
that was a
no.
teacher. Yeah.
But
No, you and I can always
if
chat
okay,
anytime. I'm always happy to help with that.
I would love that. I have so many questions for you. I'm just like, where do I even start? But I would love to backtrack a little bit because you mentioned about using cease therapy with your son. Are you okay for us to talk a little bit about cease therapy? Because
Yeah, sure.
funny enough, the episode that came out this week, so we're in March, 6th of March today, so this episode's not going to come out for a couple of weeks. But today's episode is Vivek Patala, and next week is homeopath Deborah Olenev. And she used cease therapy with Vivek's daughter who has had autism, but she also uses room dosing. So she'll do the cease therapy. She didn't want to initially because you get so many aggravations, and then she just started getting the children to hold the remedies for 10 minutes a day, and that was like the dose that they had that day.
Yeah.
And I was reading what you were writing about moving away from cease, and I thought that's so interesting because I did a lot of detox therapy, the Ton Janssen's method, a few years ago. And I don't know what's happened, but the last year or so, I've just not been drawn to it and just not been using it as much and just going back to single remedies. And I don't know if it's because I've got the school now or because I've had some more classical prescribers on the podcast. And I'm just being reminded that classical prescribing, just like that single remedy, is just so elegant. And I feel like the biggest hypocrite because I'm like, yeah, detox therapy is great. And there's a place for everything, right? There's a place for everything. But
absolutely.
Man, if we can get back to that single remedy, it's elegant is the word I would describe it. But now I want to go all the way back to how did you discover cease? Because you actually were trained by Tinus. I always have his book sitting right here.
Yeah.
I love his work, and especially this inspiring homeopathy book is beautiful. And these remedies in here I use all the time, and they are amazing. But you actually got to know the man right up until the end. Can you just tell us a little bit about that? Because part of the things I want to do on the podcast is our amazing homeopaths who have passed. Those of us who didn't get the privilege to get to work with them.
Yeah.
I would love to know more about them. Who were they? How did you find their work? Like, all that sort of stuff.
Yeah. I mean, Tinus was such an amazing soul, and I might get a little teary because I feel him with me, and yet at the same time, I still so miss our conversations. So there's moments where I think, oh, I'm going to call, there's those moments, and I know he's still there. He's still around, and he shows up when needed. But Tinus, so the way I came to Tinus was, so when I was in this clinical program and then came out of it and I was supervising students and stuff, I was always the person, there's that person in schools that always seems to see the weird remedies rather than, it's not calc. I get many more sort of the top 100 remedies now, but I just never got calc people solve they just didn't come to me. I was always seeing, and particularly, I was always seeing sacrams, lacumanum, rustox, anacardium. These were remedies I used all the time. And again, my background was a therapist. I was seeing a lot of people with therapy and psychological issues, and these are big remedies for that. In some respects, it's because of the cohort I was treating. But I had things come to me in threes. This is usually when I know that, okay, I need to stop and now I need to focus on something. And I'd had someone send me an email saying, hey, Kim, have you ever heard of this guy, Tinus Smits? He uses a lot of sacrum too. I was like, oh, no, I haven't heard of him. I'll have to look that up. But I was in the midst of running a school and supervising it. I was so busy at the time, and my kid was in school. And then a second person, I was at a conference, and they said, and I'd thrown up my hand about something and said, what about anacardium or sacrum? These seem, so this person came up to me and was like, have you ever heard of Tinus Smits? He does this thing. And I was like, you're the second person who's told me that. I must follow that up. You get home for a conference and you forget all that. And then a really close friend and colleague about a month later walked up to me, handed me Tinus's book on inspiring homeopathy. And at the time, it was this, right? It was not a book form yet. It was still a paperback because he didn't want to print it in hardcover yet because it was evolving. And I sat down and I read through it and went, oh my God, this is exactly what I'm doing. I've got to talk to this man. So I immediately shot off an email to him. And he emailed me right back and said, let's talk. And we had this long conversation. And he was amazing. And it was, you meet these people in your lives that feel like a sibling or feel like you've known them for many lifetimes before. And that was Tinus for me. We just immediately connected and bonded. And he, at the time, was thinking of putting together a group at his farm in southern France to do the first Inspiring Homeopathy, like a seminar, but not really a seminar. It was about sitting out in the open air and experiencing these remedies and then talking through what we experience and him taking us through. So we understood the layers, the aspect of what the universal layers were about. And so I said, yeah, I'm in for that. I'll do that. So I went off with a friend of mine, and a number of other homeopaths from the Netherlands were there. And it was just an incredible, profound experience. Tim writes about his experience in the beginning of Inspiring Homeopathy, and that is what it is. Tinus had a unique ability to sit and be present, really present. He was this incredibly tall Dutchman. You can't see it with me sitting down. I'm very tall. So I'm almost 6 foot tall. And I rarely meet people that I have to look up to. And I had to look up to Tinus. He was this big Dutchman, wore these big Dutch wooden shoes, but he was just this incredibly open-hearted, warm, loving person that would just hold this group as they went through these experiences. And you can imagine that taking remedies like carcinosin or anacardium, and then experiencing it, lots of stuff's coming out, pouring out. And Tinus would just calmly sit there and hold the space, say, I understand. Can I help you with that? What more can you say? Would you like? And just little interjections to help us experience it, hold it, and then come to wholeness with it and settle back down, reground, and move on. And it was such an impressive skill to watch. It was like a master alchemist at work. And we spent so many hours just talking over his table out in the garden and drinking a glass of wine and eating amazing food and just having deep conversations about homeopathy and life and all of that. And he just was an incredibly open-hearted, deep, grounded, but incredibly open soul to everything. He used to go to Tibet every year. He would sit on the edge of the Himalayas and meditate and see what his path was. And in fact, when he'd had cancer twice, the second time it came back around, I was at my farm in upstate New York. And by then I was doing these Inspiring Homeopathy circles because he'd asked me to take it back to the States. And he called me and he said, I need to tell you what's happening. And I said, what's going on, Tinus? He was in a very different space. I could tell you could feel that he was quite firm and solid in where he was going next. And I was stunned when he said, my cancer's back and I've decided I'm not going to treat it. He said, I've done what I came here to do. I have done everything I was here to do as a soul. And I'm going to allow this doorway to let me depart. And as you can imagine, that's quite a shocking thing to hear from someone. And I was in tears and said, why now? Why now? Why? Like, you treated it previously. Why now? Why does this? And we had a deep conversation about it. And I understood. He really helped me to understand. And he's still given that gift of conscious choice in being done and knowing that your time is done and making a choice to let that unfold and depart. It was amazing. It was amazing to watch, even as he got very weak and sick, that he could hold that space. He knew his path and he was committed to it. And it taught me loads, just loads. So grateful to him. And at that time when it was a couple of weeks before he died, he had called me and he said, I know you haven't wanted to teach seats, because I'd always said to him, I don't want to, Inspiring Homeopathy, that's in my heart. I was doing it before I knew I was doing it. That's who I am. Right. But he said, there isn't another English speaker that understands how the inspiring remedies are the core of cease. I need you to teach it. Will you please consider, because that aspect will die with me if you don't take it forward. And I ended up talking to Tim, who was the guy who taught me, and I had sent Tim to learn from Tinus, and we had updated his book together, and Tim had worked with Tinus to get the Cease book out. And I said, I don't know what to do with this. I'm not sure what to do with this. And he said, I don't want to teach it. He said, you're a better teacher than I am now. I want you to move forward. I want you, he said, I'm a teacher in this way. He said, but you teach in that way. You can incorporate all of this. And he said, I will help you. I'll help you put this together. And he said, I'm going to come watch you do it. And I know you're going to be amazing with it. But he said, I will help you put it together and we'll do this. And I had a naturopathic colleague at the time who'd been helping me with the orthomolecular aspect and how to better support people to not have the aggravations that were happening in the early years of cease. So we developed we've been part of the development of cease with Tinus. So it did make sense. I sat back and I agreed to do it. So I did it. And I did it until I reached a point where I thought, I can't do this anymore. I'm not comfortable with it anymore. And a lot of that for me had to do with, I was getting a lot of patients contacting me who had seen people doing cease and other detox therapy work, getting lots of remedies, lots of detoxes, lots of things, and they were really unwell. And I was having to undo a lot of the chaos that I could see sitting in front of me from incredible overuse of detox. There was a lack of understanding that people don't need to detox everything they're supposed to, right? And so I just felt like at the time in homeopathy, there was this thing going on where there was a huge explosion of remedies. There were so many more remedies being produced and people, much more than people could get their heads around at the time. And so when the detox protocols came out, the way it felt to me, I can only give my experience of it, was that a lot of people went, oh, that's easy. I can do that. It's like a protocol. I'll just, somebody's had these vaccines or that drug or that thing. I'll just do this protocol and get rid of that and I can help them without having to figure out all this other much more complicated stuff. Not realizing that actually detox is very complicated, can be, right? And there's a lot that needs to go into that. So I just decided I couldn't, with good conscience, continue teaching something that in some people's hands was definitely harmful, right? And I didn't want to contribute to that anymore. So I decided I was not going to teach it. And it was not what I had initially wanted to teach anyway. My thing was inspiring homeopathy. So I still think there's a place for cease. There's a place for what Ton does. I think Ton has done a great job of carrying it forward and doing much more of looking at it as a balancing therapy. And all, me, Ton, Roger, and lots of other people have tried really hard to say, look, this is not a protocol. These are not protocols that you just plug and play. It's not how it works. It's entirely based on your constitutional remedy also being found. That Saturday remedy is really important. And also in assessing, do they need detox? Right. And that's a big one I try and teach my own students, because a lot of people come and want to learn from me because they want to learn cease. And they say, yeah, I don't teach that anymore, but let me teach you what works better. Right. And I find today, like a lot of homeopaths seem to have forgotten the ability to evaluate that an obstacle to cure exists. Right. And so for me, I'm like you, like I reached a point with cease after doing thousands of cases that I had the gift that the Society of Homeopaths in the UK asked me to do a talk about cease. And they asked me if I could bring statistics of all these, at the time they wanted autism, it wanted to focus on autism. All these autism cases at the time, I think I had about 800 by this point. At this point, I've done way more than that. But at that point, 800 cured cases, or as far as they were going to go, right? So I looked at all of them and they wanted to know which ones definitely got better from cease versus classical remedies versus other things, right? So, and when I did the statistics, it was really interesting because I also decided to look at cease as it was originally done, which was just, we didn't have specifics about each of the vaccines, different drugs and things. We didn't have materia medica of those things to decide that needed clearing. So all we could do was clear things. So I looked at the pre-materia medica stage of cease, the post-materia medica of those things, and then also classical homeopathy. And it was very interesting to see. It didn't surprise me at all that the post-cease, the newer way we were doing cease, where we were choosing what to clear as opposed to just clearing everything, worked much better, much cleaner, and much faster than the old way of doing cease. But what I noticed was that more than 50% of cases got better from homeopathy alone.
So just like a single remedy rather than
Single remedy or
churchopathic.
series of remedies
Yeah.
on their own, no detox, right? And that those cases got better the quickest, the cleanest, right?
So
And
less aggravations.
didn't have all the aggravations, didn't have all that stuff. So it really made me step back and go, why is that? And did I need to do detox with these cases? Like, I really started questioning myself and looking back at the cases and talking to some of the families, because some of them had gone on to study homeopathy themselves, so I could have open conversations. And it was really interesting. We all got to a place of, okay, I think we need to look more at why have people reacted to these things? What's underneath it? Because no matter what detox therapy you do, that's addressing what Tinus called accidental layers. It's like things happen to us, right? Whether it's a drug, a vaccine, a trauma, a car accident, whatever. And it can get stuck, that thing. And so detox therapies, organ remedies, things like that, lesional prescribing and Asiaga, that's clearing out an accidental layer, really. That's addressing the layer itself, clearing that out of the way to then make way to see the constitution better. So if you look at Asiaga, he talks about the lesional as being all you can see in the case is that thing that's happened. That you can't actually see a deeper constitution there because they've become their disease or the trauma or whatever. And it's a classical obstacle to cure thing. You can't see the case because of this thing. And in those cases, it's totally appropriate to deal with the accidental layer and maybe use something like detox. But there's the deeper place of why did that happen to them? What was their susceptibility that they reacted to that and got stuck in it?
Yeah.
And thousands and millions of other people don't.
Yeah.
And so for me, that's what I'm more interested in. I'm much more interested in understanding, how did you get here? Do I still use detox now and then? Yes, very sporadically. I think the last time I did detox was about 3 years ago.
I think you've just really hit the nail on the head for me.
How so?
In that you were like, what is it that made them susceptible to that in the first place? Not just, and I'm specifically thinking of I haven't seen this family for a few years now because I actually moved away, but it was a never well since MMR vaccine, but the mum also did have a really big car accident during the pregnancy. And this little girl has lots of very complicated health issues, and she wasn't expected to live and all these other things, and then had MMR, and that put her into chronic seizures and everything else. And we made some great progress, but every time I said to the mum, we're going to have to do the MMR vaccine detox at some stage, because that was really when everything kicked off. And every time we gave it, she would aggravate massively, and the seizures would increase and everything else after we'd just gotten it to a good place.
Yeah.
And so it was always our clients are our biggest teachers. We learn so much from that. And I'm so grateful for the patients that have come through. And I feel so awful for the ones that I couldn't help, but at the same time, they're the ones that taught me the most. And I have to trust that there's some sort of thing where we maybe made a soul contract to come across each other's paths in this lifetime. I don't know.
Absolutely.
But she's always in my head because I'm like, what could I have done better? And then when I had Deborah Olenev on the show, and she was saying that she just does the pocket dosing of the MMR, vaccine or things like that. I'm like, maybe that's what I need to do. But I think you've just clicked it for me, because it's like, what is the thing that made her susceptible to that vaccine injury in the first place? And you could look at things like the MTHFR gene mutation and all that sort of stuff if you want to go to a more physical layer, but mental, emotionally, or maybe ancestrally, which is something I hope we get to talk about as well.
Yeah.
Maybe there was something there that actually was the thing that needed to be treated rather. But then at the same time, I think of the clients who, if a client's been on the contraceptive pill, like most of us have, I usually tend to just do the contraceptive detox with them anyway, because I tend to have really good results from it, and even the women that say they were fine, they had the contraceptive pill for many years and they were fine, they never noticed any issues. Then you do detox and suddenly their libido comes back, or all these things that they had just lived with. So then I'm like, there's a place for that in a way as well. But
absolutely. That's the thing, is like, there's a place for all these things. But I think when we over rely on any one thing, that's where things go south, right? And that's not to say that I have any issue. Like, there are some practitioners that detox is what they do. That's what they do. And that's fine. That's great, as long as they can get to the point where if the patient gets to the point where they've done the detoxes and they're still struggling, they know to then send that person to somebody doing a different type of homeopathy, right? Because that detox isn't what the person needs. And I think that's the main thing for me, because I've seen so many cases that come to me. And obviously, I'm not saying it's the majority of cases with any of these detox methods by any means. They're seeking me out because I'm a name that's associated with having done this for many years and having taught it. So they'll come to me and say, oh, I've had all this, done all these, and I'm so much, I don't know what to do. My system's a mess. I don't know what to do this. So I'm seeing the small percentage of people that had quite bad reactions to these things. I have to undo it. And the majority of the time, if the homeopath doing the detox had just stepped back and used what we know, right? Herring's law of cure, simple, right? And looked at it and went, hang on, they're going the wrong direction. This isn't what they need. And stop detoxing, step back and went, hang on, we need to reassess this instead of continuing to just give more and more. I mean, most of those cases were people that were given polys. And I mean, there are people that in 18 months had over 1,000 remedies. That's not going to help anybody. That's just going to completely confuse their system, particularly the more sensitive it is. And that was the other thing I noticed when I was doing cease, was that if somebody was more soric miasm, psychotic, even bits of tubercular, they could tolerate polys better. They could tolerate doing detox a lot better. If you had people that were more active syphilitic miasm, cancerian miasm, AIDS miasm, like getting into those radiation miasm, they did not tolerate getting the wrong thing as well.
That makes
right?
so much sense.
So I looked at, okay, what's the baseline health and miasmatic state of this person? And if I saw a much deeper problematic one, I was very reticent to start with detox. And if I did, I went very low, very slow, and very carefully. And that's the sort of thing that I think a lot of homeopaths aren't good at doing. They don't know how to do it. They don't know how to assess it, right? Like a lot of the kids that you're talking about, that room remedy, most of the autism kids I worked with, I had the parents get a singing bowl. And they would put a little water in the singing bowl and they'd put the remedy in it, and the child would come up and hit the bowl whenever they felt like they needed it. It worked great. It's like perfect. Because a lot of those kids needed to work. One of the things I learned from my autism kids is that healing happens in two different ways. And if I can understand which way the person needs, it'll go smoother. So there are people that need to heal from the inside out. There are people that need to heal from the outside in. And so if they need to heal from the outside in, things like a room remedy or hitting a singing bowl or like vernix, a lot of people work with vernix. I put it into a spray bottle and I tell them to spray themselves with it. Because
So when you
vernix
say
exists on the outer
outside
level of
in,
the skin.
you mean like energetic? You don't mean like eczema or anything like that. You mean energetic?
It can be
stuff
both.
around them.
Yeah, it can be both. Like if the person has eczema, but I can see that they've got deeper disorders inside, I'm going to work from the inside out. If the eczema is a result of something internal, I'm more likely to work from the inside out. But if it's just an external thing, I might work from the outside in. But I also look at the things, I always ask my patients, what do you find is most healing for you? What makes you feel best? If people say to me things like, oh, I feel best with soft music or wrapping myself in a blanket, or I know they're likely to be people that are healing from the outside in. And if I give an internal remedy, they're more likely to aggravate. So I will start with an external remedy, whether that's a spray, a singing bowl, putting it in a cream, whatever. Right. Hahnemann talked about all this. There are olfactory and there's skin remedies, and he used that too. Right. So the autistic kids, because they're so sensitive, and I know you understand this because you work with them, they force you to really pay attention to those sensitivities and figure out what's going to work best for them. And it forced me to be much more open as a homeopath, to use my intuitive senses much more. Right? The number of times I would sit with an autistic child sat on the floor playing next to mum, back to me, and I'm talking to mum and mum's saying something, and I suddenly start getting pictures in my head or a sound I can hear or something, and I turn and look and the child is staring at me intently, and I'm like, oh, you don't agree with something your mum's saying, and I have to figure out what you think is wrong about it, and having to unpack that and figure it out. Right? Because I'm not a naturally sort of visual psychic sort of person. I hear things, I sense things. I'm not visual in that way, so it can be tricky at times.
I think that's
So
where the telepathy tapes has been incredible. You've probably listened to that. Hey,
yeah,
holy moly, that
yeah, yeah.
incredible.
They've required me to be open to that, which has then helped me in the Parkinson's patients that I'm working with more now, because these are older people that are really shut down in a lot of ways, are really constricted and restricted in. And I've got to be able to sense what's going on with them, because a lot of times they can't communicate. They can't tell me much of anything.
There was actually, I think it was in episode 10, or maybe it was in the talk tracks on the telepathy tapes, where there was actually a story of somebody whose wife had, I can't remember if it was Parkinson's or dementia, but she couldn't speak. And he then discovered that he could actually telepathically speak with her, which is incredible. Right?
Yeah. So homeopathy has been a great gift to me, because it's pushed me into learning a lot of skills that I believe are innate in all of us. I think all of us have these skills. I don't think they're special. I don't think they're unique to me. We all have them. But sometimes you need something to bring your awareness to that thing, right? Like, I've done a lot of reading of people like Martin Miles, and Ian Watson's a very dear friend, has been for years. And they do a lot of talking about this idea of presence. And there are so many studies that have been done about homeopathy that much of the healing comes out of the actual session itself before a remedy is ever given, right? So that ability to be present, fully present for another human, and hear them and receive them fully without preconceived notions, without judgment, without any of that, just hear the story and be able to reflect that back, is hugely healing for lots of people. And it's not doing therapy, it's being a homeopath. That in itself is a remedy, right?
Yeah, well, Ian Watson is the keynote speaker for our Australian Homeopathic Conference in November over here. So I'm very excited to get to meet him in person. I've had him on the podcast a couple of times.
Good. Give him a hug from me. I haven't seen him in a while.
Amazing. Now, our listeners will kill me if I have you on the podcast and we don't talk about triturations.
Right. That's okay. I love trituration.
We have to talk about triturations. I'm sorry. How did you first get into triturations? What was your first introduction to it? And what is it about it that stole your heart?
I suppose I've been triturating for years. So I led the teleosis school for a while after Joel stepped out. And then I helped teleosis in Boston set up. And then I became part of the teleosis collaborative there. So I've been involved as a teacher and an administrator in schools for a long time. And one of the things that was always really important to me was having students make a remedy. And I think it was Joel that first did that with me when I was in school. The importance of, like, if you're going to be a homeopath, you need to know how a remedy is made, and you need to know how to experience it and do a proving. So we would make a remedy and then do a mini proving in the school. We'd make the remedy, everybody would take it home, they'd have supervisors. The next weekend, a month later, we'd come back and we'd debrief and we'd reveal what the substance was. So I did that. I've been doing that for years. And I think when I did it with Joel, it was always potentizing. But then by the time we got to Boston, and I can't tell you where it happened, but somewhere in there, I was like, okay, but, like metals, some remedies are triturated. So look, people need to know how to do both. So we would do an hour of trituration, then another hour of potentizing, so that students knew how to do both. So I'd been triturating for a long time. But then at some point, somebody had told me about, like, in Judy's books, amazing trituration handbook, like the best book that's ever been written about that. And at just about that same time, I can't remember if it was Judy or Annika. I think it was Annika that got in touch with me, and they were in California at the time and wanted me to come out and do, the amazing trituration handbook.
I just have to hold it up and put anyone on watching on the video.
No, it's perfect. And they asked me to come out. I can't remember if it was to do cease or inspiring homeopathy. I can't remember what it was exactly the first time, but I went out and to do that, and I stayed with Judy. And Annika came over and their husbands were there, and we were having these long conversations. And I just remembered the two of them. I was asking them about what they were doing in trituration, and they started telling me about this cancer angel remedy that they'd recently made. And I was like, that is something I wanted to do forever. I've always had these ideas about non-physical remedies, like things I wanted to make into a remedy. Like, one of the ones I wanted to make for years and came out of the therapy work that I'd done was I wanted to make a remedy of safety. It was I am safe. I've never done it, but it's coming. It's coming soon.
You should definitely collaborate with Ambica Waters on that one.
Yeah, it's just an important one. It's important. And so when she was telling me how they made the cancer angel remedy, I was like, I've got to do this trituration thing. And also it triggered something for me because at the time that Tinus was dying, he'd asked him and I to put the book into final form, right? And to make it a hardcover book finally, since he was departing. And I said, how do you feel about this work of continuing to evolve through me? Are you opposed to that? And I will absolutely respect that. And he said, no, that's why I'm asking you to teach it. I want you to take it forward. Why? And I said, I've always felt like the system itself is amazing and it's perfect, but the remedies are not at the right potency level. There's something missing about the remedies, and I'm not sure what it is, but there's something it wants to come in. And he said, yeah, you do your thing. And at the time, I was thinking it might be the Fibonacci. I think Joe was just starting to talk about Fibonacci potencies. I was thinking maybe that. And then when I saw Annika and Judy, I thought, oh no, this is what it is. This is what it is. They need to be brought up to the energetic level of the collective. They are universal, but they're still at the level of individual. And so we needed a triturate to bring them up. So a group of 7 other women and I came to my house in upstate New York, big horse farm at the end of a road, middle of nowhere. The name of the road was Crossroads. So it was still like, it was a joke for us always. Yeah, we're at the crossroads and we need to shift it. And when this set of remedies was done, I had to move. I was done there. It was really interesting. That's why I moved to the UK. But so we spent 3 years, I think it was 3 or 4 years, remaking each of those remedies, except for cuprum. But all the others we did as triturated potencies. They all wanted to go up to C8, which I remember sending Annika a message at some point when the first one was going beyond 4, and I was like, oh, what do I do? Sent her a message, and do you think this is okay? And she said, look, you trust your heart. You know what's supposed to happen with these. Just trust it. And it went all the way up to 8. And at 8, like every time, there were these huge, amazing lac maternum. I remember we got to C8, and we just all felt this release of this amazing, loving, warm, nurturing energy that just went out to the world. And a huge flock of crows flew in and landed on my horse farm in front of us, like literally thousands of them. I'd never seen anything like it. I've never seen them do it before or since. And it was magic. It was pure magic. It was just that first trituration, I was hooked forever. And all of our lives completely transformed in the couple of years that we did this process. For me, my son was finishing university. I had known for several years that my relationship with my current then husband was done, that I needed to let him go to be the hermit he needed to be, and I needed to move forward to do other things. And I met my now husband during that trituration, and we ended up doing a tour of Scotland, which is where I met him. And I went with a friend of mine. He said, you need to go see where your ancestors are from, because my ancestors are all from Scotland. And I met him on the tour. And all the people that were running that tour, Jamie and P, are my dearest friends. And that started my move to the UK. Wow. And I ended up leaving behind this life that I had, and everything shifted to the UK. And I feel like I'm in my spiritual home. That's where I'm meant to be. I live now on the edge of Glastonbury Festival.
Wow.
Bizarre. And music was a big part of my world when I was younger. So it's like, I feel like all my worlds have come together finally. And trituration was what opened that up, wow. And it's at the center of my heart. I'm absolutely clear that when you get up into those upper realms, you have to be conscious. You have to be aware and stay conscious and grounded and aware of what you're doing, because they can really take you out.
Yeah.
But we did. It was a good group of women I was with, and we worked in pairs. So we had 2 people to a bowl. And then after that experience, or actually even while we were doing those experiences, we would then a few months later, like in the summers, we decided we wanted to get to know remedies that we already knew, or remedies that we didn't know but felt like we wanted to know better through doing this process. So we would get together for a 3-day weekend. And I remember we did the bird remedies. And we'd triturate for a bit, but we'd just triturate to be able to get into the energy of that thing. And then we'd go sit in this area. I had this little spot in the woods outside my house we used to call Nature's Cathedral. There was a circular empty area with a stone in the middle and lots of trees, huge tall trees around. And we'd sit there and we'd just engage with that substance and allow it to teach us and learn from it. And so there's so many remedies I've learned through that direct communication that I feel like trituration has the ability to open up. There's lots of ways you can do it, but for me, trituration is a really beautiful one.
I trust that you have thoroughly enjoyed today's episode as much as I did interviewing Kim. Check back in with us tomorrow for part 2 of this conversation.